Welcome back to Radiology Made Easy. Today, I'm reviewing an abdominal radiograph of an adult patient. Upon examination, there's noticeable curvilinear calcification along the lateral margin of the psoas shadows and extending to the sacroiliac joints bilaterally. Additionally, there's some degenerative changes in the spine and both hips, but the bowel gas pattern appears nonspecific. The calcifications are highly suggestive of a very large aortic aneurysm. This finding could be incidental, but if the patient is experiencing abdominal pain or other symptoms, it's crucial to consider this condition seriously. In my usual practice, when such findings are present, I discuss the case with the referring clinician to arrange further imaging, typically an ultrasound, to confirm the presence and size of the aneurysm. If the aneurysm is large and an intervention might be necessary, a CT scan is typically required to evaluate the suitability of the aneurysm for open or endovascular repair. To further confirm the presence of an aneurysm, I also review a CT scan of the abdomen, which in this case confirms the presence of a very large aortic aneurysm. The CT image clearly shows a dilated aorta with well-defined calcifications along the vessel wall. While there are no signs of rupture on this scan, this is a critical finding that requires prompt attention. I would again collaborate with the referring clinician to discuss potential treatment options and formulate a management plan, including possible surgical intervention. For those interpreting similar cases, it's essential to recognize the different types of calcifications that can appear in the abdomen and pelvis. Common types include curvilinear, punctuate, solid, and rounded calcifications. These may be associated with various conditions such as renal calculi, gallstones, or even metastatic diseases. When calcifications are widespread, it's important to consider metabolic disorders like renal failure, hyperparathyroidism, or diabetes as potential underlying causes. A differential diagnosis should always be broad. For example, vascular calcifications can suggest aneurysms, such as abdominal aortic aneurysm or splenic artery aneurysm. Other possible calcifications include adrenal and vesical calculi, which could be due to previous infections, infarctions, or malignancies. In women, uterine calcifications might be seen, commonly related to fibroids, while adnexal calcifications could indicate dermoid tumors. In summary, on every abdominal plane film, I look for evidence of calcifications within the aortic wall and scrutinize the psoas major outlines for any abnormalities. Recognizing these signs early can be life-saving, as prompt intervention can prevent complications such as rupture. Thank you for joining me on Radiology Made Easy. Remember, every image has a story, and it's our job to decipher it. Please share your comments and feedback below, and don't forget to subscribe for more insightful discussions. See you next time.